I'd just like to take a moment to acknowledge the traditional custodians of the beautiful land that Health Consumers Council WA is on, which is Whadjuk Noongar Boodja, but like to acknowledge that we are, you know, we'd like to pay respect to elders past and present across our vast state and our nation. And it always was and always will be Aboriginal land. It's very important for us to always remember when we gather to talk about health, as we do, that there are unacceptable disparities in health outcomes between Aboriginal and non-Aboriginal Australians. So I'd also like to extend a very warm welcome to any Aboriginal or Torres Strait Islander people that are with us today. Next slide. Also would like to just take a moment to recognise the importance of the lived experience voice. This paragraph is from the WA Health Electronic Medical Record Consumer Charter. I've borrowed the wording from that, and that was a co-designed charter where we spoke to people all across WA. So we recognise the importance of the lived experience voice to be at the decision-making table as partners in the design, development, implementation and evaluation of an electronic medical record system for WA. Next slide. So I would also, just as we're talking about lived experience voice, I would like to actually give a bit of a shout out to the Electronic Medical Record Consumer Reference Group members, some of whom are with us online today. And some of us have been working on the Electronic Medical Record Charter since 2019 when we first worked on the charter, and it has taken quite a bit of time to actually get the money to actually do to actually start going on the electronic medical record. This is just a little picture of me when we're doing the expression of interest as we're still seeking a software vendor. And up on the screen, you hopefully can see there's a picture of just some of the consumers who have contributed their voice specifically to the electronic medical record project. If you are interested in following along about the electronic medical record project and digital health stuff in WA, we have a page on the Health Consumers Council website. Next page. So, as mentioned at the beginning, it is Health Literacy Month, the whole of October. I did spend just a little bit of time having a look, wanted to find out a little bit more about Health Literacy Month. The website where you can find the material is an American website, so that's why there's a Z and not an S in organisational. But health literacy, just very simply, it is divided now into two things, which is personal health literacy and organisational health literacy. And of course, the two are quite intertwined. When I was having a look at some of the materials on that website, you might want to jump on and have a look yourself. I was really impressed by the comment by one of the women on one of the videos who said, communities don't need saviours, they need tools, accessible and easy to understand tools to empower them to make best decisions for themselves. And I think we're all very passionate about that. Next slide. So we are talking, I know digital health is a really broad, I know that health literacy is a very broad topic, and digital health literacy is also a broad topic. But I wanted to bring our thinking when we have our conversation after we've heard from our speaker Danielle, we're going to have a conversation together as consumers, and I want us to be thinking around the electronic medical record. So if you can sort of imagine, like you've got my phone here is like the electronic medical record, and on one side you'll have a provider portal, so that might allow for access for GPs, for private hospital specialists, Aboriginal medical services, and so forth. And on the other side, imagine there's a consumer portal, and that is the space where we may be able to really leverage some digital health tools that really help shift the dial for us as consumers. So that's what I was sort of hoping to, as you're listening to the speaker, just have a little think about the context in West Australia. Next slide. So without further ado, I would love to hand over to our speaker. So Associate Professor Danielle Muscat, not only is she a soccer player, I should say, not a soccer mum, she's actually playing soccer. She's the Senior Research Fellow for Applied and Translational. She's the Applied and Translational Research Lead at the Sydney Health Literacy Lab at the University of Sydney. And I really recommend you go and have a look at all the stuff they've got there. I had a look at some of the really interesting webinar recordings, and that's when I hunted Danielle down and asked her if she could come and speak to us. I really wanted to start, a little bit, seeing if we could understand a little bit about what's happening in this whole world. So essentially, I've asked Danielle to help us think about, what are the possibilities of digital health to enhance our levels of health literacy and empowerment. So Danielle, I want to hand over to you. I know you've got your own slide set.
Can you see that, Pip? Is that looking
Yes,
good? Great.
I can definitely see that.
And thank you for the introduction. And I'll explain the outfit. So I was just telling Pip and Kieran, a group of friends, and I decided it was a good idea to start join a summer soccer competition this year. So I'm just coming straight from a game. So apologies for the red face and the jersey, but I'm really glad to be here today to talk to you about digital health and health literacy. And really, I was kind of really inspired after I spoke to Pip in planning this presentation at the opportunity to offer some seeds for thought and to help you to kind of formulate your ideas as you move into an electronic medical record in WA. So really, that's what I hope to do, plant some ideas, plant some seeds. I'm really happy to follow up on anything that I talk about today that may be of interest, but hopefully this sparks some really useful and fruitful conversation following my presentation. I am from the Sydney Health. So just before I begin, I too would like to acknowledge the tradition of custodianship and law of the country on which the University of Sydney campuses stand. I'm calling in from Darug land and also work from Gadigal land here as well. And so I pay my respects to those who have cared and continue to care for country. Just for some brief context, so Pip, I've got about 40 minutes, is that about right? Yeah, beautiful. Just shut me up whenever you think I'm going too long, but I'll try and stick to that. Just a little bit of context. This is some of the team at the Sydney Health Literacy Lab at the University of Sydney. So we are a growing team of researchers who are really interested in health literacy and interested at both individual and systems levels, which Pip has already kind of begun to talk about, and I'll talk a little bit more about that today. I'm also really lucky and to be part of the New South Wales Health statewide health literacy hub. So our state government has funded a health literacy hub, and our key role is to improve health literacy at the organisational level across New South Wales Health. So a lot of the work that I've been doing over the past few years is working with our health system to hopefully improve the accessibility and understandability of communication and build health literacy as well in the health system. So really kind of relevant to what we're talking about today. I don't want to make this a really academic discussion, but I do think it would be useful to kind of start with some broad definitions of health literacy to get us in the kind of frame of thinking about this. There are now like over 100 definitions of health literacy, but one that I like, which I think reflects contemporary definitions that Pip kind of started to talk about, is one that is on the screen. So it refers to the personal competencies and organizational structures, resources, and commitment, which enable people to access, understand, appraise, and use information and services in ways which promote and maintain good health. So I like to break that down a little bit because across nearly all of the definitions of health literacy you'll find these four words or variations of these four words. So can people access information? Can they understand it? Can they appraise it? And more we're talking about the importance of being able to decide whether we can trust something or trust information or not, and whether they can use it or act on the information that they find to make health decisions. So access is really about knowing where to go, how to find health information, and access and receive care in person or online. Understanding is really about being able to understand the intended meaning of health information, identify key messages. Appraising it is about evaluating whether health information is reliable and applies to your own personal situation. And then using it is identifying what to do and making health decisions to complete health actions or behaviors. Across all the definitions, and the one you'll see on the screen, is also the recognition that health literacy is not only personal competencies, but also organizational structures, resources, and commitment. And so this is a kind of visual representation of what Pip kind of talked about right at the beginning of today's presentation. And this was the one adopted by our Australian Commission of Safety and Safety and Quality in Healthcare. So early on in health literacy, in the 1970s and probably up until about 2010, all of the focus was around people's skills and abilities, and literacy, health literacy in kind of a similar way we talk about literacy. But then it became, more and more recognized that actually the health literacy environment really plays an important role in whether somebody can access information, understand it, appraise it, and use it to make health decisions. So these models of health literacy, which recognize both sides of the coin, really are more and more common today. And so this is a great model for us to kind of be thinking about, I think, as we go into thinking about what we can do with the EMR. So we know that health literacy, lower health literacy is common. In Australia, it's been assessed by the Australian Bureau of Statistics a couple of times, with estimates of up to 60% of the Australian population really struggling with some of the health tasks that we might take for granted. So, for example, in the ABS survey in 2006, they had a medication label and asked people to answer questions based on that medication label. And we know it disproportionately affects already socially disadvantaged priority populations and is associated with poorer health outcomes, including overall health status, medication errors. But just as important, if not more importantly, we know that the health information environment is really complex. So study upon study upon study has shown that written health information exceeds the recommendations for health literacy across all clinical contexts. So we did some work, for example, in COVID. We've done work in CV, chronic kidney disease, cardiovascular disease. There's hundreds and hundreds of studies that show that health information is too complex, including in print and on websites. We know that only 47% of patients discharged from ED correctly recall verbal discharge instructions because information shared in that setting is often too complex and not shared in a way that's easy to remember and understand. And we know that there's more and more kind of commercial biases and commercial determinants of health in the information that we receive online. So we have a really complex environment that we have to navigate as well. This is kind of hot off the press. It's an analysis that we're doing now. Don't worry too much about the numbers. But basically what we found was we looked at over 20,000 patients who were admitted to hospital in New South Wales in 2023. And we found that adjusting for other things, so people who reported receiving understandable communications, understandable information when they were in hospital, so information from nurses and doctors that they felt they could understand, were less likely to return to ED within both 1 month and 3 months after discharge. So we know that the way that information is provided to patients in hospital settings and healthcare settings is really, really important, and it impacts real-world clinical outcomes such as readmission in our analysis. So this is where we're at. We've got an environment that's really complex. We have people with a range of health literacy skills and challenges. And so it kind of creates often environments which are kind of difficult to navigate. Again, I didn't want to get too academic, but I do want to present this because it comes up a little bit later when I was reflecting on some of the things that we could think about in terms of the EMR. So one of the models of health literacy, when we're looking at an individual's health literacy, We often talk about different levels of health literacy, ranging from functional, communicative, to critical. And they're meant to, as you can see visually represented, they kind of build on one another. So, functional health literacy refers to basic skills in reading and writing, as well as knowledge of health conditions and health systems needed to understand and act on information. The next level is communicative health literacy, are more advanced skills. Can you access, understand, can you discriminate between health information from different sources and apply that information to make an informed decision? So, a little bit higher order. And then critical health literacy is kind of advanced skills that enable people to think critically about health information and really exert lots of control over their health decisions. This is all really conceptual, so I like to try and give a bit of a crude example, but hopefully to kind of place those in a health context. So, for example, if we look at the medication label on the screen and we think about what kind of skills do people need in understanding that. So, if we talk about functional skills, it might be are people able to read the label and then correctly take the medication? So that would be thought of as some of the functional skills we might need to engage with that health stimulus. Communicative skills, for example, these are just examples. Can somebody ask questions of healthcare providers and use that information to know for which conditions this kind of antibiotics is going to be effective for? So a little bit higher level skills than just being able to read and interpret the medication label. And then critical health literacy, can somebody assess the reliability of online information about antibiotics or advocate for change? And so I think this model has been very influential in thinking about health literacy, but it also can think about the different types of things we might do within the EMR to build different levels of skills. So I'll come back to this in a little bit. Digital health literacy is very related to health literacy. And similarly, in the definitions of digital health literacy you'll see today, they also recognize that it encompasses both individual skills and capacities to use digital health technologies and whether the digital health environment is meeting community and consumer needs. So it's both of those sides of the coin as well. This is one model of digital health literacy that kind of taps into some of that idea that it's both individual skills and the complexity of the digital environment we're trying to navigate. So in this framework, they talk about people's engagement with their own health, their ability to process information, and engage with digital services. So they're all thought of as digital health literacy skills. But you'll see that right at the top, it also says that the digital services need to suit individual needs. They need to work and they need to create environments where people feel safe and in control. So again, we need both an environment that is accommodating for diverse health literacy needs, and we also need some level of skill at an individual or community level to be able to engage with digital tools. We know that in the same way that health literacy is linked to our health outcomes, that digital health literacy is linked to things such as lower service engagement, self-reported health and quality of life, and use of online information. And we also know that it's socially patterned. So national data.
Is it just me
Danielle,
that's lost, Danielle? Oh,
Danielle's connection.
sorry, Danielle, we did lose you.
Sorry?
We lost you for a little while there.
Oh, can you hear me now?
We can hear you now, yes.
Sorry about that. So I don't purport to be an expert in EMRs by any means. But I was having to think about how we can begin to apply, and hopefully this is something maybe that you'll go on to think about, um, health literacy in your thinking about EMRs over the next few years. Is it okay, Pip, the connection?
Yes, we can hear you really well now.
Good.
I don't know, you
Okay.
just suddenly dropped out. Yeah, it was just that previous slide. I was just thinking, perhaps with the previous slide, I don't think we quite got to hear the last sentence.
Oh, no worries. This one?
Yes.
Yeah, no worries. So there's no national data on digital health literacy. So we barely have data on health literacy at a national level. So there's no national data on digital health literacy per se. But there is some national data on digital ability, which really shows that it's socially patterned. So lower rates among people already experiencing disadvantage. So, for example, people with less education or income or living in rural and remote areas. And I'm sure you're really aware of that, but I think it's something that we just need to kind of keep in mind. So, hopefully, you've already got some thoughts flowing about how this might translate into the work that you guys go on to do with the EMR. But I guess if it's helpful, I'll share a couple of thoughts that I was having. So, first and foremost, a lot of the work that we do, we know that health information is too complex. We know that the way that information is formatted is not easy to navigate or understand. So a lot of the work we do is redesigning information to make sure that it does meet health literacy needs and principles. And of course, that is something that can be applied to the design of the EMR. Um, I will take you through an article that was written that actually looked at the information quality and usability of My Health Record within a health literacy framework. And I'll just show you the framework or the types of things that they were thinking about in seeing whether the EMR met health literacy needs. And then I'll take you through a couple of tools that we commonly use as well in our work, but haven't been necessarily used in EMRs. So, in this article by Louisa Walsh and colleagues, they basically had a checklist of things that they went and assessed My Health Record against, which related to health literacy. So, and you'll see there's quite a few health literacy checklists that exist, and a lot of these overlap with validated checklists that I can also share with you after this. So basically, they looked at the My Health Record, and they looked at things such as, does it put the most important information first? And as health consumers, you guys are really well placed to kind of say what is the most important health information, right? For example, does it provide action steps? And this is really important in health literacy, not only making sure that information is readable and easy to understand, but has really clear steps or actions that patients can then, put into place or act on. Have they used plain language? And I'll show you a tool that we've developed to assess that in a minute. Is paragraph size limited? Did we use bullet points and lists and meaningful headings? And Pip, I'll share these slides if that's useful for you guys as well. Does it use white space? Does it have most important content above the fold? So, in the first screen that you see without any scrolling. Is it disability accessible? So it had kind of a really large, long checklists, buttons with meaningful labels, simple and engaging homepage. So it was quite long, but I thought I would show there offering the content in multiple language, tailoring the information using intuitive interactive graphics and tools. So I really liked that because it was directly taken from a study that looked at kind of electronic health data. So again, it could be something, and of course they use this in an evaluative way to see if, but it can also be applied prospectively. So when we're developing the information, ensuring we're meeting all of these things. One of the recommendations in this checklist was to ensure that the language was simple, and I thought it might be useful just to showcase the shell editor that we've developed in our team. So this is an online, basically readability calculator and text editor that helps people to check how easy their information is to understand. I want to say up front, and you guys don't need reminding of this doesn't negate the need for consumer engagement, and we often think about it as one step in a process, which you'll see a bit later on. But the shell editor was developed by Julie Eyre, who is a wonderful postdoc in our team. And it will tell you whether the text you've written meets certain health literacy guidelines. So the first is readability. It will give you a grade reading score, and lower grade reading scores means that the text is easier to understand. In Australia, our recommended target is often grade 8. I'm just going to turn on the light in my car, otherwise you're not going to see me in a minute. There we go. And oh, you don't want to hear my music. And grade reading score is lower when texts have shorter words and sentences. So it seems really simple when you break it down like that, but if you have text that has lots of kind of simple sentences with short words, it'll be easy to understand by the majority of people. But it also gives you, the shell editor also flags when words are really complex or represent medical jargon, which is really useful in health contexts. And that's underpinned by a really large thesaurus of 270 million words. So, for example, if you copy and paste this text about anxiety, it will flag all of the words that represent complex language. And I've got a little video of the editor in a minute. Oh, no, it's right now. So, can you see the video going, Pip? So it doesn't have any words, but it's just
Yes,
I'll talk through
can
it.
see it going. Yep.
So this is the shell editor. You'll see on the right-hand side is all of the health literacy metrics. You copy and paste your text in, and it will highlight things that are tricky and give you your grade readability score, and flag which words are long, which sentences are long, and which words represent complex language. So this tool was co-designed with New South Wales health staff and shown to be effective. But what's important, so if we actually change the sentence here, you can see in real time that we're getting the grade readability score is updating, and we're removing some of those highlights. So it's just a real-time tool that gives you kind of updated metrics in terms of health literacy. So we're researchers. We did a trial to make sure it works, and we found that it did. And that involved 188 Australian health information providers, so mainly New South Wales health staff, and they were asked to revise 3 texts on different health topics. And we found that the original text is in orange, and using the shell editor, we were able to reduce the grade readability score down to that recommended grade 8 level, which was excellent. So it does work. I did want to mention before, so I mentioned earlier in the presentation that I'm also part of the New South Wales Health Literacy Hub, which is our state government funded health literacy initiative, which brings together the University of Sydney and New South Wales Health. And what we've also developed is a 5-step process known as the Electronic Patient Communication Portal. So it's a digital portal and 5-step process to help staff to develop health literate patient information materials. So patient-facing information that meets health literacy recommendations. And the health literacy editor, the shell editor, is embedded within this 5-step process. But you'll also see that there's a couple of other things. So the shell editor is in there. And particularly important is people log in, they register that they want to develop some information. So just say I'm working in a cancer clinic and I want to develop some information about some aspect of care for patients. register that you want to develop something. You download some standardized templates that we have. You develop the content using the shell editor, make sure it meets the health literacy standards and requirements. And really importantly, step 4 is reviewing the resource with consumers for feedback. We've just undergone a redesign process, so it no longer looks like this. And we've also included co-design with patients as the first step, as well as this review process. So what's really important, I think, and I don't think I included the slides, but we actually found that when we evaluated this, engagement with consumers had added value over and above in things such as the shell editor. So that's why we've created a kind of a staged process for the development of health information that meets both of those needs. And it's not crazy to think about such a process informing, for example, some of the information that might go into an EMR. So really happy to kind of talk about more about that. This is also a health literacy checklist, which isn't dissimilar to the one that was used to evaluate my health record, which is embedded within the EPCP. So again, being really clear about the purpose of the information, focusing on key messages, giving people clear actions to take, using simple, clear language and action words, and making sure the layout is easy to read. So really happy to share these resources with you guys as well. Okay, so we're scaling up the EPCP across New South Wales over the next few years. So the hope and intention is that we get to a point where every single patient-facing material developed by our health system has gone through this rigorous process, meets health literacy standards, and meets our national requirements for accreditation as well. So that's one thing that we can do in terms of ensuring that the information in our EMR is written in a way that a majority of people is going to understand and be able to act on. I also wanted to flag, and I'm happy to share the seminar series link with everyone that Pip mentioned, but we had a wonderful webinar about presenting numerical information to patients as well, which I don't have time to touch on, but it was really useful. So I'll share that, Pip, in case you want to kind of go through that, because obviously a lot of the information in the EMR will contain numbers. So I think that's a good one to also reflect on. And there are definitely ways to ensure that numbers are presented in a way that's easier to understand as well. So the other flip side of our health literacy models that I talked about at the beginning is that we can simplify health information as much as possible and ensure it meets diverse health literacy needs. We can also seek to build health literacy to help people navigate EMRs. And that's exactly what's been done in a couple of studies. So in this work, which was about empowering patients through digital health literacy and access to electronic medical records, they kind of talk about, instead of making patient records inaccessible, the better solution will be to implement strategies like improving digital health literacy, which helps patients to better understand their health records and minimize the risks and challenges that come with implementation of e-health. And I'll return to that. So I think a lot of work has been done in building people's skills to navigate electronic medical records. My health record that's implemented here. A lot of community-led programs to ensure people know how to access it and understand the features of the EMR or the health record. So in that way, building people's skills to be able to use the EMR is something that we can do in conjunction with ensuring the information on there is easy to understand. But I guess when I was thinking about that, and that's why I decided to kind of show this model early on, that's really getting at the functional health literacy skills. So probably that first level skills. Can we build people's skills and knowledge and confidence to actually access the EMR? And we can definitely do that with structured training and resources. But We might also have the opportunity, and again, just planting seeds here, after being inspired when talking to Pip, we might also have the opportunity to do a little bit more. Yes, we can help people to understand how to use EMRs, but potentially we could also build health literacy through the EMR. And this might be crazy and too far-fetched and too much, and that's okay. That's something for you guys to think about. Um, but I did really want to kind of share an example of where this has been done. So in this work by Helen Ann Brown Epstein, it talks about building health literacy by enhancing electronic health records with information connections. And this is an example from the US. So they have MyChart, which is the patient-facing portal of Epic. So very similar to the EMR that we're talking about. And you'll see here it says, so the colorful, entertaining website or videos walks a patient and their family through sections with details on connecting and sharing health information, messaging, scheduling and appointments, payments and insurance, preferences, and mobile features. Um, oops. Within the health section is the invitation to search the health library to find articles about health symptoms, procedures, and other healthcare topics. So each hospital decides which patient education information resource the MyChart should be linked to. When the tool asks if the patient wants more information, the patient can be sent to, for example, HealthWise or Medline Plus, and we can think of similar things in Australia. So at the author's health system, within discharge instructions, the patient care team can request information on relevant topics be linked to the patient MyChart record. So I hope you can kind of see that this is doing more than upskilling people to be able to use the EMR, which is definitely health literacy, but it's really kind of building skills, knowledge, education through the EMR and through some information referral services and within the EMR. So in that way, it kind of represents a bit higher level health literacy skills, if that kind of makes sense.
Yeah, that really makes sense to me, Danielle. It interests me that I've been thinking about digital health almost exclusively for some years now, but I didn't fully appreciate that in my head. I've always dreamed that we would build health literacy through an electronic medical record. That's always been my dream. And what you've talked about is actually helping people to access digital technology, is where I think the system is a little bit stuck. I just want to sort of
I agree.
clarify too, just for our listeners in West Australia. So my health record, you might remember, is the federal one that has your GP stuff on it. It will have, hospital discharge summaries. It'll have your test results. And then the electronic medical record we're talking about is what happens within the hospital walls of a public system. So it's including stuff like your progress nursing notes. So it has different information. Some of it's the same, but not all of it. So I hope that that's clear. So I have personally, we worked with another digital CRC. I can't remember now which university it was, but essentially when they were looking for what's actually out there in terms of resources for consumers on learning how to use tools, it's sort of all about, this is how you get onto the My Health record.
Yeah.
But you really, I don't know, articulated for me, and perhaps it's just a bit of a dull moment. I should have realised this all along, but that's our dream, I think, is that what we get in this state will assist us to build our health literacy. Definitely. I think that's
Yeah,
the
and
opportunity
hopefully
we're
it's a
looking
little
for.
bit of a framework to do that. And you're exactly right. A lot of the what I've seen in terms of community-based programs have really been about that. Right, let's teach people how to get on to that. It's not actually building health literacy within those systems. So what a cool opportunity you have if that's something that might be possible. I'm just
Totally.
going to go through to this one and then I'll stop talking because I feel like I've talked a lot. But my last point is, why don't we have both? So we've talked about simplifying the EMR, and we've talked about building health literacy skills at different levels, so functional, but also those higher level skills, Pip, in that you're really hoping to get towards, which is great. That's definitely not saying you can't do both at the same time. And we developed an app for chronic kidney disease patients in Australia that's currently being trialed at the moment. And I kind of wanted to show this diagram that we published because we explicitly really did both. So we tried to use strategies to reduce the complexity of the content within the app. So that was calculating readability statistics. We applied something called the Patient Education Materials Assessment Tool, which is very similar to those checklists that I show you today. We supplemented written information with audio-visual wherever possible, and we included kind of micro-learning and snippets and quizzes and things like that. So we tried to reduce the complexity of the app content, but also include features and education to improve patients' health literacy skills. And this included things like embedding question prompt lists, help sheets to help people to change their behavior, and kind of training in shared decision making and communication as well. So I'll share some of those. So, for example, we had question prompt lists about asking questions about your medications, about fluids, which is really important in terms of chronic kidney disease, to really building people's skills to be prepared to ask questions of their healthcare providers. And you'll see
You can
also kind
find
of
a lot of
embedding
information about
animation.
health online. To know whether you should trust this information or not, ask 1. Who said it? 2. When did they say it? 3. How did they know? 4. Additionally, notice what the website looks like. This can be important in knowing how trustworthy it is. Click on the tabs below to find out more. At the end of this section, you should be able to open a website and decide whether to trust or trash the information.
So we had a series of animations such as these to kind of build those critical level health literacy skills. And I think this is a different one. Yep. So also things to
Talking
support
with
people
your
to talk
healthcare
with their
team
healthcare
is an
team.
important part of living with kidney disease, but it isn't always easy. Sometimes we're not sure what to say in our appointments. It can be hard to ask questions or talk about things we don't understand. The word PACE can help to prepare you to talk to your healthcare team and get the most out of every appointment. P is for provide information. A is for ask questions. C is for check you understand. E is for express how you feel. Click on each of the PACE tabs in this section to learn more.
So, not to say that these are perfect or directly relevant to the EMR that you're hopefully going on to develop, but really to give examples of how we tried to use interactive modalities to communicate and to build skills to do different kind of health tasks. Yep. So I guess my final reflections, and then I'm happy to take questions before I think you guys are going to break out and have some thinking time, is I really liked this quote from one of the papers that I showed earlier. Ultimately, the involvement of all stakeholders holds the key, as the participation of healthcare professionals, administrators, and patients in decision-making processes foster stakeholder buy-in and acceptance of EMR systems. And I would say does much more than that as well. So what a wonderful position you guys are in to be able to shape this. And I hope this has provided some food for thought for you guys. Please contact us at the Sydney Health Literacy Lab. That's our website, or me via email at any time. Really happy to kind of chat more about this.